Hello friends, this is Nishant. Let's discuss a tough yet very interesting topic, that is anti-cancer drugs. Anti-cancer drugs are tested quite frequently in various competitive exams like USMLE and NEET. So they are quite essential to know. So let's get started. These are my references for this video. Before jumping into the drugs, let's briefly review the cell cycle. Cell cycle basically has four phases: G1 phase, S phase, G2 phase, and M phase. Each one of these phases has a specific function and has few characteristics. So for G1 phase, it is that the cell prepares itself for DNA replication, which is said to occur in the S phase. So DNA replication occurs in S phase, and in G2 phase, cell prepares itself for mitosis, and mitosis occurs in M phase. So if you just remember it briefly like this, I think it will be of great help in understanding the anti-cancer drugs. The anti-cancer drugs are divided broadly into two categories: the cell cycle specific drugs or CCS and the cell cycle non-specific drugs, that is CCNS drugs. So let's have a look at cell cycle specific drugs first. Cell cycle specific drugs are, again, depending on their site of action, broadly divided into four categories. Those that act on M phase are taxanes and vinca alkaloids. Then those that act between G1 to S phase, that is those that stop the G1 to S phase transition, that is etoposide. Then a broad category of drugs called as antimetabolites that act on S phase, and bleomycin that inhibits the transition between G2 to M phase. Cell cycle non-specific drugs are again divided into five broad categories. Number one, alkylating agents. Drugs like cyclophosphamide, ifosfamide, lomustine, carmustine, busulfan are in this category. Drugs number two, platinum analogs. Drugs like cisplatin, carboplatin, oxaliplatin are in this category. Number three, anthracyclines. Drugs like doxorubicin, danirubicin, epirubicin are in this category. Number four, topoisomerase 1 inhibitors includes drugs like irinotecan, topotecan. And number five, antitumor antibiotics. Like that is two main examples are mitomycin C and actinomycin D. So let's have a look at some specific and key points about each one of these drugs. In the competitive exams, they usually focus on mechanism of action and side effect of these drugs and how to avoid that side effect or how to decrease that side effect. So that is what my focus is going to be. The first two of antimetabolites, that is 5-fluorouracil and sepsitabine, inhibit the enzyme thymidylate synthase. The thymidylate synthase is an important enzyme in purine synthesis in that it catalyzes the conversion of DUMP to DTMP, that is deoxyuridine monophosphate to deoxythymidine monophosphate. This inhibition of these steps results into increased level of DUMP that results in instability in the structure of DNA. Sepsitabine is a prodrug of 5-fluorouracil. Coming to the side effects, a very characteristic side effect is hand-foot syndrome. It's quite specific for these two drugs. That is, there is pain, erythema, tingling, numbness, and swelling of the palm and sole. Then, it is also called as palmar plantar erythrodysesthesia. It is important to remember that almost all anti-cancer drugs cause myelosuppression by inhibiting the bone marrow. One key point in 5-fluorouracil and sepsitabine is that this side effect, that is hand-foot syndrome and myelosuppression, can be suppressed or can be decreased to some extent by giving uridine triacetate. So this is the new development in this area. The next two drugs, that is 6-mercaptopurine and 6-thioguanine, there is three things that are quite specific about them. Number one, they are activated by the enzyme HGPRTase, that is hypoxanthine guanine phosphoribosyl transferase, and their active metabolites are inactivated by the enzyme xanthine oxidase. They inhibit multiple steps in purine synthesis, but these two are key points for these two drugs, and their main side effects are bone marrow suppression and hepatotoxicity. The key point is, as these drugs are inactivated by xanthine oxidase, in patient who are taking xanthine oxidase inhibitors like allopurinol, febuxostat, the dose of these drugs needs to be reduced. So the key point for these drugs are three. Number one, they are activated by HGPRTase. Number two, they are inactivated by xanthine oxidase. And number three, their dose should be reduced in patients taking allopurinol. The next two drugs, cladribine and fludarabine, they inhibit the enzyme ribonucleotide reductase. They exert their anticancer property by inhibiting this enzyme. Their side effects mainly are myelosuppression, and one specific side effect for fludarabine is arthralgia. Key points about them is that it's very important that cladribine is used in treatment of hairy cell leukemia and fludarabine is used in treatment of chronic lymphocytic leukemia. These are drug of choice for these two conditions. One more key point that I would like to add is that cladribine is resistant to degradation by adenosine deaminase enzyme. The next drug is our friend methotrexate. Methotrexate, as I'm sure most of you might be knowing, acts by inhibiting the enzyme dihydrofolate reductase. It is used in treatment of various cancers and autoimmune conditions like rheumatoid arthritis, etc. Side effects, very common, perhaps the most common side effect of methotrexate is mucositis. It also causes myelosuppression and in long term it causes hepatotoxicity. The treatment of side effect is done by giving the patient folinic acid or leucovorin. Next drug is cytarabine. Cytarabine inhibits the DNA chain elongation. It causes something called as chain termination. At high concentration, it also inhibits the enzyme DNA polymerase, hampering the DNA replication. Its main side effects are myelosuppression with pancytopenia with megaloblastic anemia, and very specific side effect for it is cerebellar ataxia. Next two drugs are paclitaxel and docetaxel. They prevent the deassembly of microtubules during M phase. So during M phase, what happens is that microtubules are arranged in this fashion to aid the cell in cell division. So there are two processes that occur. Number one is their assembly and number two is their disassembly. So the disassembly is inhibited by taxanes, that is paclitaxel, and the assembly or the formation of their structure is inhibited by the vinca alkaloids. So main side effects of paclitaxel are hypersensitivity reaction and peripheral sensory neuropathy. Hypersensitivity reaction is an important one, and for docetaxel the main side effects are neurotoxicity, again similar to paclitaxel, and a specific side effect that is fluid retention. Vinca alkaloids, that is vincristine and vinblastine, they inhibit the polymerization of microtubules. So the drugs inhibiting the polymerization are vinca alkaloids and drugs inhibiting the disassembly are taxanes. The major side effect of vinblastine is bone marrow suppression, and the major side effect of vincristine is peripheral neuropathy. It is important to remember that vincristine is a marrow sparing drug. You can remember this by remembering the fact that there is a word blast in vinblastine, in that it blasts the bone marrow. Etoposide acts by inhibiting the enzyme DNA topoisomerase 2. Its major side effects are GI distress, myelosuppression, and hepatotoxicity. Etoposide therapy, a key thing to remember about is that it can cause acute leukemias. That is, they generally occur 1 to 3 years after the therapy. And the leukemias are not lymphocytic, they are monocytic or myelomonocytic leukemias. The next drug, bleomycin, it acts by forming oxygen-free radicals that cause breaks in the DNA. Major side effect is pulmonary fibrosis. However, it also causes skin hyperpigmentation. The enzyme metabolizing bleomycin is deficient in lungs and skin, which is why we can see these side effects. Coming to alkylating agents are a broad group of drugs. Their mechanism of action is quite similar. How they act is that they cause alkylation of the DNA, that is, they transfer the alkyl group to DNA that results into cell death. The cell death is due to the formation of cross links in DNA strands. In general, their major side effects are myelosuppression, that is the big one, then alopecia, and very important one, that is secondary leukemias. The first two drugs, cyclophosphamide and ifosfamide, the key point to remember about them is that their side effect, that is hemorrhagic cystitis. It is due to one of their degradation products called acrolein, and it can be avoided by giving vigorous hydration and by giving a drug called as mesna. Mesna is mercaptoethane sulfonic acid. The next two drugs, that is lomustine and carmustine, are highly lipid soluble drugs and they can penetrate the blood-brain barrier. That is why they are used in treatment of CNS tumors like gliomas. The specific side effect is delayed neutropenia. Procarbazine, although it's an alkylating agent, unlike most alkylating agents, it affects RNA and protein synthesis, whereas most alkylating agents have effects on DNA. It is one of the most leukemogenic alkylating agent, and a very important key point is that it causes disulfiram-like reaction. So can you guys remind me of the drugs that cause disulfiram-like reaction? Yes, so they are procarbazine, asparginase, metronidazole, and there are many more. Next drug, busulfan. Key point about it is that it causes pulmonary fibrosis, skin hyperpigmentation, and adrenal insufficiency. So these three are important side effects. Can you guys remind me of a drug that caused the first two side effects, that is pulmonary fibrosis and skin hyperpigmentation? Yes, it was bleomycin. The next group of drugs is platinum containing compounds, that is cisplatin, carboplatin, and oxaliplatin. Their action is similar to alkylating agents, but the only difference is that instead of donating an alkyl group, they donate platinum group to form cross links in the DNA strands. Their most common side effect is nausea and vomiting, in that they are one of the most emetogenic anti-cancer drugs. They are nephrotoxic, ototoxic, and neurotoxic as well. Cisplatin is the most nephrotoxic drug. Carboplatin is a strong bone marrow suppressant, and oxaliplatin, the side effect that is seen more often is neurotoxicity. Then a very important point about cisplatin, the nephrotoxicity of cisplatin can be decreased by giving the drug amifostine along with it. One more question that they may ask is, what electrolyte disturbances does giving cisplatin cause? So it causes, you can remember that it causes all hypos, like hypokalemia, hypomagnesemia, hypocalcemia, and hypophosphatemia. Hypomagnesemia is an important one. They test it quite often. It basically causes magnesium wasting in kidney. Antitumor antibiotics, that is mitomycin C and actinomycin D. Actinomycin D, what it does is that it inhibits the DNA dependent RNA synthesis, that is transcription. It's a good radiosensitizer, like it can be given in patients where we give chemotherapy and radiation. Mitomycin C, the key point to remember is that it can be used as intravesical therapy, that is inside the bladder, for superficial bladder cancer and anal carcinoma along with radiation. Its specific side effect is that it causes delayed bronchospasm, the mitomycin C. The next group of drugs, that is anthracyclines, that is doxorubicin, daunorubicin, and epirubicin, their very important side effect is dilated cardiomyopathy. This side effect can be decreased by using free radical scavengers like dexrazoxane and alpha tocopherol. The next two important drugs are irinotecan and topotecan. The mechanism of action is that they inhibit the enzyme topoisomerase 1, DNA topoisomerase 1. The major side effect of irinotecan is diarrhea, and the major side effect of topotecan is neutropenia. Irinotecan also causes something called as cholinergic syndrome, in that it inhibits the enzyme acetylcholine esterase, and it causes cholinergic activities like diarrhea, hypersalivation, lacrimation, and increased fatigue. Irinotecan is metabolized in liver, and its dose should be reduced in hepatic failure. This becomes important because irinotecan is part of a regimen that is used in advanced colorectal cancer. So friends, this is all about anti-cancer drugs. I tried to cover all the high yield points that I thought were important. Thank you so much for watching the video, and I hope to see you all in the next video. Thanks and good luck.